Hello, good day everyone. For today's topic, we'll be discussing on the continuation of chromosomal aberrations. But specifically in this lecture, we'll be talking about the various diseases associated with chromosomal disorders. Now, these are the learning outcomes for this lecture. We'll be comparing disorders caused by chromosome number variation or aneuploidy, as well as structural aberrations. We'll also demonstrate a understanding on the type of abnormality involved and characteristic features of each chromosomal disorder. And we'll also explain on how some genetic disorders are diagnosed. Now, we have two main types of chromosomal abnormalities, and these are your numerical aberrations as well as your structural aberrations. Now, when we say numerical aberrations, this would involve changes in terms of the quantity of the chromosomes that are found inside the cell. When you say structural aberrations, this will involve segments of chromosomes that are either deleted, translocated, inverted, that would form specialized structures called ring chromosomes or isochromosomes, and there are some chromosomes that would form hybrids. There is a usually high frequency of human chromosome disorders. And in these types of human chromosome disorders, most embryos are spontaneously aborted. The alterations are too disastrous because developmental problems would result from biochemical imbalance. There would be imbalance in regulatory molecules such as hormones, transcription factors. However, certain conditions are tolerated that will result into survivability of organism. However, there are some features that are deviated from the normal phenotypes, so it would result into a characteristic set of symptoms pertaining to a certain chromosomal disorder that would result into a syndrome. The first type of chromosomal aberration that will manifest as disease is categorized under aneuploidy. When aneuploidy occurs in humans, syndromes can result. Again, when you say aneuploidy, we refer here to as an extra chromosome or a lacking chromosome. So we are referring here to the quantity of the chromosome, not the entire set. So examples of aneuploidy would include trisomy 13, trisomy 18. Trisomy 13 is the Patau syndrome. Trisomy 18 is the Edwards syndrome. We have trisomy 21, or also known as the Down syndrome. We have Turner syndrome, Klinefelter syndrome, and the double Y syndrome or the XY syndrome. An example of trisomy, a very good example, is Down syndrome. Down syndrome is also known as trisomy 21. This is a type of aneuploidy wherein you have an extra chromosome on the 21st type chromosome. In terms of nomenclature, we have this type of nomenclature. Normally, we have only 46 chromosomes. But in Down syndrome, since you have an extra autosomal chromosome on chromosome number 21, this is the nomenclature. This is how it is written. 47 XY or XS. And then you have an annotation plus 21. The plus 21 there stands for an extra chromosome, an extra autosomal chromosome on the 21st chromosome. XY, of course, is male and XS is female. Survival rate for this type of trisomy is very high for this non-disjunction. The non-disjunction rate in Down syndrome increases with mom's age. So again, the basic pathophysiology of Down syndrome and the most common cause of Down syndrome is non-disjunction. Trisomy 21 is also one of the most common causes of mental retardation. The average IQ for people with Down syndrome is around 25 to 74. An average person would have an IQ level between 90 to 110. Down syndrome would have several characteristic features, which are short stature, broad hands, stubby fingers and toes, a wide rounded neck, and a large protruding tongue, which makes speech difficult. Now also Down syndrome, people with Down syndrome would have a high incidence of respiratory infection, heart defects, and some neoplastic diseases such as leukemia. So how do you identify a person or a baby or an individual with Down syndrome? Now Down syndrome, we initially diagnose it with the characteristic features of the one that we see in a person. So here on the top illustration, this characteristic feature is a flat nasal bridge. We have macroglossia. When we say macroglossia, you have an enlarged tongue. You have an enlarged and protruding tongue. We have an almond-shaped eye causing epicanthic fold. So this is an epicanthic fold. Upslanting of palpebral fissures. So these are the palpebral fissures. There's also a single palmar crease and a short fifth finger that curves inward. There's an irregularly shaped mouth. Microgenia, when we say microgenia, you have a short chin and a widely separated first and second toes and increased skin creases. So again, characteristic feature of Down syndrome are the facial features. You check the hands and the toes. The incidence of Down syndrome is 1 in 750 live births. Mothers in their early 20s have the risk of 1 out of 1,500 of chances of having a child with Down syndrome. Women over 35 years old have a risk factor of 1 out of 70, which jumps to 1 out of 25 for women 45 years old and above. So as you can see, maternal age is also a risk factor for a child having, or for a certain mother of conceiving a child with Down syndrome. So if you're a female and you got pregnant 40 years and above, there's a higher chance of you having a child with Down syndrome. So again, this shows you the association of incidence and maternal age. As the maternal age goes higher, you have a higher incidence of Down syndrome. When you say incidence, it's new cases of Down syndrome. And this is a typical FASI of a person with Down syndrome. So how do we screen patients for Down syndrome? So we usually perform several tests. One of the tests is ultrasonography. So we check on the features that are present in the fetus. Also, we can perform amniocentesis. In amniocentesis, we collect fluid, amniotic fluid, and then we determine the fetal cells. We characterize the fetal cells by analyzing the chromosomes. We can also perform karyotyping analysis. You can also perform chronic venous sampling or CVS. For chronic venous sampling, we usually take tissue samples from the placenta, not the amniotic fluid. The next type of chromosomal disease that we'll be discussing is Edwards syndrome. Edwards syndrome is trisomy 18. You have an extra chromosome in chromosome number 18. The shorthand nomenclature for Edwards syndrome is 47XY plus 18. And the incidence is only 1 in 11,000 live births. This is quite lower in contrast to that of Down syndrome. It is uncommon for fetuses with this condition to survive. So what can a survivor expect? So if a fetus with Edwards syndrome or trisomy 18 survives, 30% of these children die for the first month and only 10% would survive for 1 year. There is severe mental retardation and other characteristics of infants having trisomy 18 is that they would have an elongated skull, a very narrow pelvis, rocker bottom feet. Now this rocker bottom feet, This is a congenital vertical talus. So remember that your foot contains the talus, contains a bone called talus, and talus would comprise your heel bone. So it will form a prominent heel bone. It would be a convex round bottom shape of the foot. The ears are often too low set, and the mouth and teeth are small. And nearly all babies born with this condition die in early infancy. The average lifespan of individuals or fetuses or infants with trisomy 18 would have only 2 to 4 months. They are small at birth. They have clenched fists with overlapping fingers, rocker bottom feet with protruding heels. Again, the talus is enlarged, as you can see here. You have a rocker bottom feet. You have an elongated skull with low set ears with congenital heart problems as well as mental retardation. So this illustration shows you the rocker bottom feet of individual with Edwards syndrome. Now, other trisomies of interest is trisomy 16. This is the most common chromosomal abnormality, but the fetuses never survive past first trimester. If an embryo contains a trisomy 16, they would usually die during the first trimester. Many first trimester fetuses are lost in this fashion because many are silent abortion. Next type of syndrome is Patau syndrome. Patau syndrome is written as this way. It's 47XX plus Y. Its occurrence will only occur in 1 in 15,000 births. This is most aborted naturally. The survival is 45% would die in first month and 90% by 6 months, and less than 5% reach 3 years. So again, Patau syndrome, it's trisomy 13. Why is death so frequent in Patau syndrome? So there's severely abnormal cerebral function and virtually always lead to death in early pregnancy. So that's the main reason why in Patau syndrome you have a lesser chance of having survivability in contrast to Down syndrome. So again, for Patau syndrome, you have trisomy 13. So what are the characteristic features of infants having having trisomy 13? You have an average lifespan of around 6 months. Infants would usually have cleft and lift palate. They would have small eyes. Polydactyly, we say polydactyly, we have multiple fingers or extra fingers. We have congenital heart defects as well as severe central nervous system disorders. Okay, so this is an example of a cleft and lip palate, which is also found in Patau syndrome. You have polydactyly, you have an extra finger. Now let's move on to monosomy. Monosomy will refer to, this is a type of chromosomal aberration in which you have fewer chromosome in each body cell. So you have lacking chromosome. Generally, if a chromosomal mutations occur during meiosis, one of the gametes would have monosomy and when the other half would have trisomy. So a good example of monosomy is Turner syndrome. So Turner syndrome is only 45 chromosomes. You have only one sex chromosome, which is chromosome X. Ideally, the sex chromosome should be paired because one would come from the mother and one would come from the father. But for Turner syndrome, you have only one X chromosome. Its incidence is 1 in 5,000 births. In Turner syndrome, you only have one X chromosome, as you can see in this karyotype. What are the characteristic features of chromosomes? In chromosome syndrome, these are women. Okay, they are females. Okay, because of course there's no chromosome Y. they can live relatively normal lives, though they are unable to bear children. The phenotype of these female includes short stature, short, broad neck, and broad chest. And intelligence seems not to be affected. So for Turner syndrome, we have these features. We have afacial features. We have low hairline. We have a fold of skin over the neck. They have the constriction of the aorta, we have this condition coarctation of the aorta. We have a shield-shaped thorax. We have widely spaced nipples. We also have a poorly developed breast, an elbow deformity, a rudimentary ovaries, or also known as a gonadal streak. And this is the reason for the gonadal streak is that these individuals would have an underdeveloped gonadal structures. They would have amenorrhea, or they have no menstruation. They have brown spots or nevi. Nevi is the plural for nevus. Nevus, in layman's term, are just moles. So for Turner syndrome, they would have short stature, webbed neck, broad shield-like chest with widely spaced nipples. Next is the sex-linked trisomies. The very good example of a sex-linked trisomy is the Klinefelter syndrome. Klinefelter syndrome is written as 47XXY. Therefore, this is a male having an extra X chromosome. Another example is Jacob syndrome. Jacob syndrome is written as 47XYY. Therefore, you have an extra Y chromosome. And Jacob syndrome is also known as the supermale syndrome. Now, Klinefelter syndrome is a disorder occurring due to a non-disjunction of the X chromosome. The sperm containing both X and Y combines with an egg containing the X, resulting in a male child. The egg may contribute to the X. This is you would have a lot of female characteristic in a male body. Now for Jacob syndrome, it occurs in 1,800 births. You have 47 chromosome and you have an extra Y chromosome for this. It is also known as the super male. For Jacob syndrome, these individuals would be tall, would have a lot of acne, you have a superior muscle strength, reduced muscle coordination. They are physically normal and mentally normal. They would have high testosterone and would be more aggressive. And they have a normal lifespan. Next, we'll move on to structural abnormalities or structural aberrations of chromosome. The first syndrome that we'll be discussing is the Cri Du Chat Syndrome. The Cri Du Chat Syndrome is the terminal deletion of the short arm of chromosome number 5. There's a deletion. Okay, so the chromosomal aberration for this one is deletion. So as you can see there, the normal chromosome in chromosome number 5. For Cri Du Chat Syndrome, you have a terminal deletion of the short arm or the P arm of chromosome number 5. Clinically, patients would have microcephaly with dysmorphic facial features, would have cardiac defects, hypotonia, and severe mental retardation. Cri Du Chat Syndrome affects females more than males. Incidents would range to 1 to 15,000 to 50,000 live births. Now, some cases of Cri Du Chat Syndrome may be undiagnosed, making it difficult to determine the true frequency of this disorder in the general population. Now, why is it called Cri Du Chat? Cri Du Chat means cry of the cat. It sounds like a cat because these patients would have hypotonia. They would have a voice like a cat. And what's the reason for this? Because of the improperly developed larynx. So improperly developed larynx would result in too high-pitched voice, resulting to hypotonia. Now again, this is caused by deletion of the short arm or chromosome number 5. They are severely mentally retarded. round face, low set ears, presence of heart disease, and have a small cranium. They would have speech and language characteristic, delayed speech and language development, problems behavior such as hitting, pinching, kicking, and biting. They would have difficulties like overactivities, restlessness, impulsiveness, inattentiveness, distractibility, and misarticulation. So how do we diagnose individuals with Cri Du Chat Syndrome? First is you have to assess what is present physically in the patient. So we perform clinical evaluation. When we say clinical evaluation, what we see of a person. Physical history and physical examination. That's the first thing. Next is to identify the characteristic finding. And to confirm this one, you have to undergo karyotyping or fluorescence in situ hybridization. Next syndrome is Prader-Willi Syndrome. Prader-Willi Syndrome occurs around 1 to 10,000 to 25,000 of individuals. And this is due to the deletion in the long arm of chromosome number 15. Okay, you have a deletion in the long arm of chromosome number 15. As you can see here. Again, this is in contrast to that of Cri Du Chat. There's both Cri Du Chat and Prader-Willi Syndrome involves deletion. But in Cri Du Chat, you have a deletion in the short arm. But in Prader-Willi Syndrome, you have deletion in the long arm. So the characteristic features of Prader-Willi Syndrome results from the loss of function of several genes on chromosome number 15. The genes on chromosome number 15 would involve gene coding for small nuclear RNA or SNORNA genes, which helps in regulating other types of RNA molecule. And therefore, this would contribute to intellectual disability, behavioral problems, and physical features of the disorder. So what are the physical features of Prader-Willi Syndrome? Number 1 is compulsive eating. There's obesity, poor sexual development, and poor sexual development. They would have hypogonadism. If they have hypogonadism, this will result into fertility problems and reduce secondary characteristics. They would also have behavioral problems such as varying degrees of mental retardation, speech impediments, poor muscle tone, floppy baby, and poor sucking reflex. So Prader-Willi characteristic, they are usually obese. This is the typical features of Prader-Willi Syndrome. They have truncal obesity. For Prader-Willi Syndrome, this is the loss of paternal chromosome. Loss of the paternal chromosome 15q11 to 13 region, meaning it occurs in chromosome number 15 in its long arm in segments 11 to 13. The characteristics, they have intellectual disability, short stature, underdevelopment of sexual organs, and obesity. In the US, it occurs 1 in 15,000 to 30,000 live births, and both sexes are equally affected. For Angelman syndrome, it's the loss of maternal chromosome in 15q11 to 13 region. Its characteristic features, they are relatively severe compared to Prader-Willi syndrome, and they would have severe neurodevelopmental delay. Its incidence is 1 in 10,000 to 20,000 live births. There's no gender or racial predominance. So what are the clinical presentations of Prader-Willi syndrome? At birth, they would have hypotonia and lethargy. They would also have feeding and breathing difficulty, and undescended testes in males can also occur. Now, what is the problem in undescended testes in male? In undescended testes in male, this would incur a higher risk for testicular cancers because our testes should be contained in an environment that is lesser, that contains a lesser temperature compared to our body, meaning it should have a cooler environment. So in undescended testes, you would have you would have a higher risk for seminomas or testicular cancers. During childhood, patients with Prader-Willi syndrome would manifest with hyperphagia, meaning they would usually eat a lot, an insatiable appetite, meaning they are voracious eaters. They are always hungry. They always crave for something. And in effect, they would have weight gain and obesity due to high ghrelin levels. Now, ghrelin is a hormone that would stimulate appetite. Ghrelin for Ghana. Now, incretin is the opposite of ghrelin. Incretin would suppress appetite. For patients with Prader-Willi syndrome, they would have a higher ghrelin compared to incretin levels. They also have small hands and feet, strabismus, speech delay. When you say strabismus, this is the weakening of the extraocular muscle resulting to an asymmetric position of the iris. So they would have lazy eyes. They also have mild intellectual disabilities and behavioral issues. During adulthood, these individuals would have borderline intellectual capability, short stature, hypogonadism, some facial features such as almond eyes, narrow forehead, and triangular mouth. For Angelman syndrome at birth, they would have microcephaly and feeding issues. During childhood and adulthood, they would have severe developmental delay, inappropriate laughter, seemingly happy demeanor, and a short attention span. When you hear the term Angelman syndrome, think of happy puppet syndrome. They are children that are very happy. They seem not to have any problem. They lack proper speech, and they also lack the use of nonverbal communication. Movement disorders can also develop, such as ataxia, fine tremors, and jerky movements. They would have prominent mandible or the jawbone. They would have flat head. Again, like Prader-Willi syndrome, they can have lazy eyes or strabismus, seizures, and sleep disturbances. Now, Angelman syndrome is due to a microdeletion of the long arm of chromosome number 15. It is inherited on maternal chromosome. The signs and symptoms that they are mentally retarded, cannot speak, and prolonged periods of laughter. So this is the typical craniofacial features of Angelman syndrome, and they have a happy demeanor. They're just happy people. Now, the last disease is Fragile X syndrome. Fragile X syndrome is a genetic disorder that is caused by a break or weakness of the long arm. Okay, this is the long arm or the Q arm of chromosome X. The syndrome, Fragile X syndrome, occurs in 1 to 5,000 individuals, with males affected more than female. It is the second most common inherited cause of mental retardation due to chromosomal abnormalities. And the signs and symptoms would include mental retardation, large ears, prominent jaw, and pale blue irises. Now, this ends my lecture on chromosomal abnormalities. Thank you.